Welcome to the Digital Health and Innovation Podcast, a publication of the Southern Medical Association. This podcast will educate and inform listeners on the various systems and methods that use information, data, and communication technologies to help resolve problems, reduce inefficiencies and costs, improve access, increase quality, and help make the practice of medicine more personalized and precise.
Good afternoon, everyone. We have a very interesting podcast for you today on clinical informatics. My name is Andy Mohan, and I am the co-chairman of the Division of Digital Health and Innovation for the Southern Medical Association. And I'm joined by our one and only Ms. Jennifer Price, who's the educational manager for the Southern Medical Association and today's moderator. Today, we have a very interesting speaker. Mr. Joseph Lassiter, MS PharmD, is the president and managing advisor for the Robertson Group, a consultancy based in Portland, Oregon. Prior to full-time consulting practice, Dr. Lassiter was the associate director for medication use informatics and technology at the University of Michigan Health System. Dr. Lassiter completed both the Bachelor and Master of Science in Pharmacy degrees at St. Louis College of Pharmacy and a Doctor of Pharmacy degree at University of Florida College of Pharmacy. He's an experienced pharmacy leader who has practiced in areas of direct patient care, clinical informatics, and health system administration over the last 20 years. I would like to thank Mr. Lassiter on behalf of the Southern Medical Association for joining us today. And so let's kick this off. I'm going to kick it over to Jennifer, and let's get this discussion started.
Wonderful. Thank you so much for that. And first of all, thank you both for joining us today. We really appreciate your taking some time to talk with us. Dr. Lassiter, first off, what is clinical informatics and why is it important to practicing physicians?
Well, thanks, Jennifer and Andy. I really appreciate you having me on this podcast to be able to talk to your audience and to be able to interact and dialogue about this important topic. Always nice to talk shop, and especially to be able to talk shop with an interested group. So thanks for the opportunity. One of the largest organizations that reviews informatics or has informatics as purview is the American Medical Informatics Association, or AMIA. And their kind of $10 definition of clinical informatics is that clinical informatics is the application of informatics and health information technology to deliver healthcare services. You can also hear this referred to as applied clinical informatics or operational informatics. And I think that's a great way of framing it. Really what we're looking at is I see clinical informatics as indirect patient care. Meaning these people practicing the informatics area aren't directly taking care of patients, but those who practice in informatics are empowering those who take care of the patient and hopefully helping streamline their day so that's more efficient, provide the information at hand that they need, and that they're able to better care for those patients in their care. That's why I think it's really important for those involved to be clinicians, and that's why I think it's important to practicing physicians. As we know, everyone who uses technology today, from our iPhones to the electronic health records to dragging, dictating your notes, everywhere in healthcare today, we are surrounded by health information technology. And so it's important to be interested and involved and part of the solution and help developing workflows with clinical informatics.
Could you give us some examples of projects in the informatics space that you've been working on?
Yeah, thanks, Jennifer. I think that one of the things that's really important for this group is this idea of physician efficiency. Dr. Moyan and I have talked about this a lot, and we're probably in the teenage years of electronic health records. We're definitely not at the birth of them, which is good. I think it was an abrupt time for us all who are here to midwife or help deliver these electronic health records 10 or 15 years ago. Now we're at the point where we have these tools, they're pervasive, and we need to be able to deliver on the promises of them that we had started out with. And part of that is collecting all the information and making sure it's able to be acted upon, it's visualized, and that physicians can get through their day. We hear a lot in the trade publications the ideas of how many clicks it takes, how much effort it takes for physicians to get through their day. And It may sound minuscule, but I think it's very important when you compound that interest of the number of clicks it takes to really take care of the patient. It does, it can perhaps take some time away from the patient. And it also, I think it adds to the physician's day. We starting to see trade articles or published articles about physicians really attacking on this electronic health record work at the end of their day, responding to messages, charting, following up on messages from consulting teams. And I think we have to be concerned about that, not only for a work-life balance standpoint for physicians, but also for this idea that we need to make sure that they're able to efficiently work through the system. Andy, do you have any thoughts on that? Somewhat you've seen in your practice? Is that one of your main concerns as well, physician optimization?
It's been this. There's a good and bad of when you were mentioning teenage years. There's a good and bad right now. I think that the way things are going to trend, things will be getting better for physicians as the technology becomes better. Right now, there has been some struggles and frustration because a lot of these physicians they tend to wait to document at the end of their day, and they're focusing more on their patients, which they should be doing, and it just makes them have to stay later, and they're not able to get home to their families. So there's a lot of struggle there. But I think that as the technology gets better and as physicians get more apt to using the technology, it's going to be so much better, and things will become more efficient. So there's a good and bad right now, but I think things are getting better. They're trending to more of a better way in utilizing those records, those EHR, the EHR technology.
I think that's spot on. We're hearing, outside the technology sphere, this idea of resilience in healthcare professionals, the need to pay attention to work-life balance, and it allows clinicians to be refreshed and renewed and ready to take their patients. And we can't have that if technology is contributing to that burnout. So I think that's definitely a key metric going forward. One of my takes on the electronic health records is I actually think that we probably need to look for a new name for these tools. I think in the advent of electronic health records, that was a great name for them because it's helping people transition in their minds from the idea of using paper tools to electronic tools. But in contemporary practice, these tools have almost become health operating systems or operating systems for the hospital, more akin to a platform like Apple or Microsoft has. Everything: clinical care, financial care, scheduling, patient interactions, telemedicine. It's all occurring through this platform. So I'm still searching for a name. I'll try not to trademark it when I find it, but I hope to come up with something clever that we can use in the future. But and this circles back to needing people like Andy who can bridge the gap between clinical practice and health information technology practice. So we started off kind of talking about why is this important to practicing physicians, and I think just that. The people who know what tools they need are the folks taking care of patients. And so this has to be a clinician-driven practice, I think.
It has to be clinician-driven. I think it's also important to educate patients that may not know what's going on in healthcare in terms of technology to understand the frustrations that are going on right now, so that they can give their physicians a little bit of leniency. Their physicians, nurse practitioners, what it may be. It's a difficult time, but that transition is going to lead to better quality of care. But I'm just not sure if the patients understand it. So this kind of podcast is great for patients and just general listeners too, to kind of understand where things are going and the future trends.
Yeah. Great point, Sandy. I think that we're going to see more interaction with the patient portals. Those are going to evolve to be help patients and their caregivers manage their health. As someone who's having parents that are aging and needing to help take care of them and coordinate their care, especially remotely, living in different states, I think it's important to have those tools at your fingertips so that you can help them make informed decisions. So I think the technology is also an expander for the caregivers and the patients that it affects.
You mentioned
circling back to your question. Go ahead, Jennifer.
Go ahead.
Oh, okay. I was going to circle back to you had mentioned the question you had asked about some other projects we work on. So, in addition to that physician efficiency, kind of along the same line, we're seeing some electronic health record, or fancy name to be named, optimization and remediation. And so, we see this in health information technology. When we launch, there's a few players in the space, and they have a lot of influence and customize the electronic health record. But then over time, we regress to the mean a little bit and look to standardize it. And standardizing electronic health records helps with interoperability across sites. It helps be able to make maintaining the system and updating the system easier to patch, to make it more resilient to cybersecurity attacks, and then also to make it easier to update it and get the latest features and functionality from the EHR vendors. So we're seeing in the field more projects to help people go back and look at their electronic health record now that they've been on it for 8, 10, 12 years, and kind of do a state of affairs and seeing what needs to take place. Along with that, there's a lot of affiliate clinics optimization. So health systems are starting to partner with smaller clinics and be able to extend their care into regions. And because of that, those affiliate clinics or smaller physician practices are joining the health system, and they're taking on new workflows for using technology to take care of their patients, new policies and procedures and things like that. So we're spending a lot of time assisting with that, as well as these affiliates become part of the health system and extend the ability for the health system to do patient care within a larger region. Two of the other topics that we are working on a lot are analytics. I think it's a bit of a buzzword right now, but it's important on everyone's mind. And what I see analytics is one of the promises of electronic health record. This idea is that all of a sudden now we'll have all of our data in one place, and we can interact with it and take care of populations, make informed decisions financially, operationally, clinically. But I don't think we're at that stage of promise yet. We have a lot of information, but we're still struggling as a profession to get that information out and get it visualized so that it's actionable for clinicians and administrators. So we're seeing a lot of requests for help with that. And I think that one of the areas we'll need to look at, and in healthcare in general, is having more people trained in data science and having more people trained in analytics so that they're able to apply clinical knowledge, apply practice knowledge, workflows, and gather the information that's needed and queue up that in dashboards or other ways that it's visualized and actionable for the people that need it. For the practicing clinician, a lot of this is also ties into clinical decision support, which has to be a little bit beyond alerts just popping up in everyone's face. I mean, if we browse the web when we're on our free time, those of us who don't have small kids and have free time, that we block all the pop-ups. We don't want pop-ups anywhere. Yet in the health information technology informatics world, we use pop-ups as a way of getting people's attention. And so I think we'll continue to need to figure out ways to really present the key information that a clinician or an administrator needs in the moment, and then they can act on it. And to me, that's really what analytics is.
Yeah, the pop-ups have always been a very important key discussion point amongst physicians in practices and on the inpatient setting. It's just it's a lot of them are typically ignored. So there's probably some data showing that only 1% of it is something that is utilized by physicians. So getting something that's going to be more of a meaningful pop-up, so physicians don't just ignore them, that's going to be a very important piece going forward. To your point, I think they are important. That clinical decision support is very, very important for physicians, and it's a very helpful tool, but we just have to make sure the right data and the right clinical information is built in there that's going to be helpful to a physician instead of hindering a physician and adding an extra 2 or 3 more clicks to their day. which honestly, every click matters, and every second matters throughout a day for a clinician. So these kind of things are going to have to be optimized and changed to just make things, make it more efficient and better for physicians, and make things more efficient.
100% agree. I think it's really what we're looking at.
A few minutes ago, you touched briefly on trends, and I would like to revisit that a bit more. What are the informatic topics or trends that you see developing in the next few years?
Thanks, Jennifer. I was kind of going back and forth in my mind when I was going to drop this buzzword, but we're hearing a lot about artificial intelligence and machine learning in healthcare, and really that to me is kind of combining this idea of analytics, clinical decision support, automation in a nice package. And really, what I think where the field is going is releasing clinicians and others from the mundane tasks that we should be able to automate and replicate with 100% success, and allowing people to practice on their top of their license, rather than having them clinicians work on things that perhaps that can be programmed into an adaptive electronic health record. So I think we're just at the very tip of the iceberg there. I know there's almost every client we work with is talking about that, and I think there's going to be a lot of innovation happening in that space. I'm not really sure what it's going to look like, but that's the ultimate goal, to be able to pull out meaningful things from the electronic health record and be able to analyze them, present them to the key decision makers who need to see it, and also free up people from these rudimentary tasks so that they can use their cognitive knowledge in other areas. Additionally, I think we're going to see, kind of tied with that, if we look at the electronic health record vendors in the country, I know there are people who exist in that market, but within the U.S., there are two predominant players, Cerner and Epic. But I think it's time that we're going to see some innovation in that area. We've heard rumblings from Google getting into that space. Amazon is talking about getting in that space, and it'll be interesting to see what comes out about that. I think when we look at the infrastructures that health systems have put in place to support either a Cerner or Epic install, they're going to be very wary to move to an innovative electronic health record. However, the Google and Amazon are also approaching it with fresh eyes, and really, in a lot of ways, it looks like a physician-driven workflow. So I think, if nothing else, that's really going to inform the current state of clinical informatics practice, and see what they come out of that as they test it, as they get leaders who have worked in the governmental bodies or leaders who have been CMIOs at different organizations and kind of helped influence the design of those electronic health records.
That's a great point, Joe. Another thing that I think about is precision medicine and preventing patients to even go into the state where they're going to go into the hospital. We want to keep them out of EHRs and those type of things, and keep them healthy. But precision medicine is basically genotypic, compiling data from genotypic information, phenotypic information, and then getting that information, that clinical data from EHRs to tell a story about each patient, so that you can keep them, prevent them from going into the hospital. So I think that's also going to be playing a big part. I know Vanderbilt, my alma mater, they're working very heavily on that type of that work now, doing a lot of studies with the government on how to compile this data and tell a story about a patient. Preventing them from going into the hospital is going to be very, very important coming in the future with using this clinical informatics data. I don't know what you feel about that, Joe, but any thoughts on that?
Yeah, I think that's a great point, Andy. I think managing the populations in your region and using the technology to be able to do that. I think we're going to see, as we see the drivers of cost, the idea of keeping patients in ambulatory settings or even at home to provide their care, and less patients going to the right patients going to the emergency department, and the right patients getting admitted for critical care or surgical procedures or things like that, where it makes sense to have them in the acute care setting. I was going to mention, and you teed that up nicely, Andy, is that this idea of telemedicine. From a technology standpoint, I don't think it's anything revolutionary, but really I see this becoming more pervasive to take care of patients at home, to be able to do video visits, to have caregivers join the meeting remotely from a different location and hear what's going on with their loved ones. I think we're finally starting to get over some of the technological barriers from a bandwidth standpoint that we've seen in more rural areas of the country. And we're starting to see incentive programs and regulatory barriers that happen. I know that in certain states that the boards of pharmacy, the boards of medicine have been very cautious about adopting this technology in their role as protecting the patient. But I think we're starting to see the tide turn for that a little bit. And these will be more important in the future and kind of tie into those patient portals that we talked about earlier as well. And when you mentioned the precision medicine, one of the places I think of, Andy, is I think St. Jude is really leading the charge along with some other institutions to get patients' pharmacogenomic data as part of the electronic health record. So anytime any provider is looking at treating them with a medication, which is, as we know, is one of the primary modalities for treating patients in the United States, that they have their genomic information right at their hands and they can make informed decisions. Again, when I say it out loud, it doesn't sound revolutionary, but that's really where we need to go.
Jennifer, is this getting you excited right now to hear all this?
It's actually very interesting because as a patient, I had a conversation with my mother recently, and she's trying to understand her physician moving to the electronic record and not having as much FaceTime with her because, he's working in his charting and she's used to the physician, pulling up the chair and talking, but she's trying to learn, because he spent some time explaining to her what he's doing and how this is improving medicine as a whole. And so it's really kind of interesting as a patient and someone who's very involved in the medical community, the medical field, to kind of see both sides of this. So I actually am really intrigued by this.
That's great. It's really nice to hear, and great job for your mom's provider, to her physician, to be able to kind of talk her through what he's doing with the electronic health record. I agree with you. The way the workstations are set up in the room, sometimes it seems more like a barrier than it actually is. It's more of a dialogue between the patient and everything's getting recorded in the electronic health record, but it's really helpful to talk through that.
And she really appreciated it because she was a little frustrated. She sees us when we go to visit her, rightly or wrongly. Sometimes we may get on our phones and get a little involved. And that's frustrating. And then to see her provider sort of doing the same thing without really knowing why. But once he explained it, she was really kind of fascinated and wanted to learn more. So, and even kind of made a comment, "Oh, I don't have to worry about your horrible handwriting." Sometimes doctors are known for their less than perfect handwriting. And so she said, well, that's kind of encouraging as well.
Yeah, I don't think all clinicians have bad handwriting. I think mine is pretty good. I don't want to throw everybody under the bus with that one, but it's I think the handwriting obviously comes in because they have to get all this information on paper back then, and now thankfully we have something that you can put in to a system and make things a lot easier, and it's much better, and it also reduces a lot of the errors that potentially can happen because you can't read half the stuff that they a lot of these guys are putting on paper, so it's made it much better there. And I think patients are going to see better quality of care, better outcomes, and less errors, and just more time with their providers moving forward.
That's exactly right. And I think that, I weep for the future pharmacists who will no longer be the Sherlock Holmes of deciphering physicians' handwriting. But I think that's probably good to relegate that to the past, along with leeches and other things like that. But I agree with you, Andy. Not everybody has the most terrible handwriting, but it was always fun to decipher. Along those lines, from a patient safety standpoint, I started seeing the last 6 months or so, perhaps even longer, but this idea of needing some sort of federal legislation around healthcare data privacy. If we look at the age of the HIPAA and kind of what has changed in the technology space since HIPAA was passed, I really think we're going to see more information about that. Patients owning their own healthcare data, having the right to have it being portable and accessible. There was a little bit of controversy recently with Epic kind of weighing in on one side of it and Cerner weighing in on the other side of it. But it's clear to me that the Office of the National Coordinator wants to move this forward. And I think it's a good thing for patients in general. We need something that some federal guidance that we can use to design these systems and put policies and procedures in place.
Yeah, I read that. I happened to read that. Read about that as well with Epic and what they're doing and Cerner. It's very interesting stuff. I think that patients have the right to carry their own data with them, their healthcare data, so they can go anywhere that they want. Even if they left the country, they would have their medical information with them, and they would be able to tell a story just in case they have some sort of medical condition that comes up abroad. They would have that with them and would help out their providers, even not in the United States, somewhere else. I think it's kind of important to have that for their quality of care, quality of life, in case something comes up.
Exactly right. And I think that
would you like that, Jennifer, if you were able to have that with you, without having to request it from somewhere? How easy would that be?
That would be amazing. And
it'd be amazing.
Having even traveled abroad and had, I was traveling with people who ran into some health issues. And so if you could have that on your phone or your smart, any of your devices, and you could just give that to somebody. Instead, we were dealing with a 15-hour time change, and it was almost impossible. And so having something like that, I think, could have saved a lot of time, angst.
Yep.
So absolutely.
Sorry, Joe. Go ahead.
Right. And I think patients. No, that's a great question. And I think that, to Jennifer's point, I think patients are going to lead this charge as well. A lot of times we're thinking about the vendors designing this for practicing clinicians, but we also have to take into consideration what the patients are demanding access to, in a good way, demanding access to. That reminds me of what I was going to mention earlier was this idea of wearables. If when I'm traveling, I look, and almost everybody now has an Apple Watch or a Fitbit or something along those lines to record what they're doing, with this idea they want to be active and healthier and have concrete information about their health status. I'm not sure we have a good strategy in healthcare to integrate that information into electronic health records and to act on it, or if we need to. But there's a lot of patient-specific data that's sitting on our wrist everywhere, and so something we have to think about moving forward.
Yeah, that's the telemonitoring thing would be. I think that'd be great for specific diabetic patients and kind of seeing the trends of their blood sugars and hypertensive patients. It's just that technology itself is going to keep expanding, and they're going to be able to do a lot more with that Apple Watch. Who knows where it's going to go? But there's things that are definitely going to. This is just the beginning of that piece of technology, and also integrating within electronic health record systems and assisting providers and providing the best care that they possibly can for their patients. So I see a lot of good things coming there.
Yeah, that's exactly right, Andy. I don't know if we didn't talk about, or I didn't mention Apple when I was talking about innovation before, but I think it's clear that their health is a key pillar of some of the design they're thinking about as the tools, the iPhones, iPads, wearables, become a key part of our lives. They're making sure that we have access to health information in addition to other information. And so I think you're right. I was amazed when I was watching the keynote and they were talking about measuring your rhythm and your blood pressure and all the things that could be happening with just the Apple Watch. And so I think they're going to continue to push that envelope. You can't talk about this innovation without talking about the payer market too. I think that all has to evolve. When we compare ourselves to other countries and the number of pairs we have and the nuance, I think you're right. It complicates things.
It complicates things quite a bit. So,
I think on the flip side, just talking, do you think that, if I have my information, do you think people are going to think that Big Brother is watching and things like that? Because, it is smart technology. And yes, it is, I'm sure, data breaches and things like that. Do you think there will be a fine line between empowering patients to have their information versus, wait a minute, if I have it, can someone else get it? And is this going to, maybe frighten
Absolutely.
people and things like that?
Well, there is a
Yeah,
value.
I think so. I think 100%.
Go ahead.
I think that's what people's main concern is right now, this balance of accessibility and privacy. And I don't know what the answer is. We might want to look at some of these other encryption technologies where like you have a key, somebody else has a key, and you can only share it with that person. Kind of what we're doing to encrypt messaging and things like that. I think only putting it in patients' hands are going to make them feel safer. But you have to balance that with all the clinicians who need to access it throughout the day. I mean, think of a typical here, you go inside the hospital, there's patients, dietitians, respiratory therapists, med students, physicians, all these people need legitimate access to your information. And so explaining that to somebody who has something exposed to that, I think it's going to be, it's going to be interesting as we have this public debate.
Are there any final thoughts you would like to share with our listeners? Either one of you, we would love to hear any additional thoughts you might have.
Well, my final pitch, Jennifer, thank you, is that I think informatics, health information technology, this integration with clinical practice is going to continue far into the future. And I implore your listeners, patients, clinicians to become involved in that process. At the committee level, at the workflow design level, at the influencer level, and make sure that we are designing these to help facilitate care and not be barriers to care. So I think that everyone should add this to their topics. And if you ever see Dr. Mohan speak about it, go listen to him speak at the next conference you go to.
Appreciate that, Joe. Yeah, we look forward to speaking a little bit more about this and enjoyed your time with us, Joe, and thanks a lot, Jennifer, and that's all. I'm appreciative to be a part of this and speak with you guys, all of the different speakers that we have on these various topics in healthcare technology.
Well, we appreciate you're both taking the time today. I'm sure our listeners are going to glean quite a bit of information. And again, we appreciate your giving us some time this afternoon. Thank you very much.
Much appreciate the opportunity.
Thank you for joining us. To subscribe to additional podcasts, visit sma.org/podcasts.